Hey, medical sales manager, it's Peggy McKee. I am known nationally as the medical sales recruiter, and I wanted to share with you the results from the survey that you took so much time to answer for me a few weeks back. So this video is just for you, just going over those results. I'm going to roll through it much quicker than I would for if there was a sales candidate or account executive that were wanting to know more about how to dress for the medical sales interview. I'm going to go through that a lot slower for them, but for you guys, we're going to cruise through and just give you the high points, okay? So thank you very much for joining me here. We did put together an interview Attire questionnaire survey and sent it out to over 1,000 medical sales managers and got a pretty healthy response, and here are the results. First question that we ask, tell us, does a skirted suit versus pantsuit for a female make a difference? 35% of you say yes. I was really surprised by this. But when I listened to the comments, and I'm going to roll through those and you can read those while I talk, I think it's because you think maybe the skirt would be uncomfortable, they wouldn't be as relaxed in it, or the length of it could vary in a situation. When we asked you if it would affect your hiring decision, most of you said no, but there was a small percentage that said yes. Then we had a few more comments and discussions about that suiting problem. We moved on and we asked you about heel height or shoe style. And believe it or not, 60% almost say that shoes matter. And I had heard this before, but most people, especially females, don't pay attention to their shoes. I mean, we buy nice shoes, but we don't very often get them shined up, and they can look pretty nicked up. Most men do the shoe shine thing. If you don't, you need to. Again, we had some comments from managers about why those shoe lengths and heights and things might make a difference. We asked about the full suit versus the coordinating jacket for a male candidate. And 52% of you said a full suit. I was surprised it wasn't even higher because most of my managers want to see a full suit and a jacket won't work. Not for an account executive sales role. And we had some additional responses from you guys about that. We asked about current fashion trends. It doesn't seem to be that important to you. You think that whatever was professional in the 90s and possibly even in 2001, 2002 is still professional today. The next question we asked was about a tie. 90% of you want to see a tie. You even gave us some tips about what to do and what not to do with the tie. We asked about the portfolio or the briefcase. I was surprised to see that over 90% of you do notice that. I thought you did. I didn't think that many people know about that or how it could impact your decision. You also noticed jewelry. 92% of you noticed jewelry. And we asked for some comments and we got some. Basically, don't overdo it. Keep it simple. We asked about cologne. 35% of you have let it affect your hire. I was impressed with that because I've not experienced in my face-to-face interviews problems with cologne or perfume. Facial hair on the male. 82% of you said it affects the evaluation. And I can tell you I had a candidate earlier this year that was nixed for a job that he was really excellent for. But the manager said he had a strange-looking facial hair thing going on. We're not talking about unshaven. We're talking about one of those different types of goatees and things like that. And he said he couldn't see his physicians responding positively to that candidate with that particular facial hair. And you guys gave us some comments as well about that. We talked about short hair versus long hairstyles for females. Doesn't seem to be a critical factor. You had some discussions about that. Again, it's the clean, well-maintained, fresh haircut piece. And we ask about whether or not your intentions toward salary would be affected by what a candidate wears. And 53% of you said it wouldn't, but I can tell you I side with the yes on the 46% because I know that I've sat and looked at someone's clothing in the interview and thought about my salary. Can they be overdressed? Sure, they can, but it doesn't seem to be as big an issue as you might think, or I would have thought. Business casual, do you ever tell them to wear it? I was so pleased to hear 82% of you don't. It's really a sticky place for candidates, business casual. I always tell them to lean toward business and not casual. Here are some responses and comments that you guys had. Interview faux pas. Chewing gum, curse words, phones, eye contact, unkept clothing. How the interview attire has affected your decision. Can you give us a specific example? And so we had one manager who talked about the Southern Cal candidate with the athletic shoes. I've actually had that happen myself, so I know that that's not an unusual occurrence. We've also had trashy outfits, stop the interview before it starts, perhaps some of your assets being on display that shouldn't be there. And in men, maybe a suit that isn't fitting the way it should. Has your interview attire expectations changed over the last decade? Doesn't seem to be so. Seems to be that if it's professional in the 90s, in the 2002, in 2010, it'll all be the same. I really want to thank you for your time participating in the survey. It was very, very helpful, and it'll be really useful for those folks who are trying to enter or are just interviewing in the medical sales arena. I hope this has been interesting for you as well, and I appreciate your time. If you want to get in touch with me, you certainly can. My email address is Peggy, P-E-G-G-Y, at phcconsulting.com, or you can give me a call directly at 888-263-5688, extension 100. Have a great day.